Good evening, everyone, and thank you so much for attending our town hall for House District 102. And here we have Judge Clay Jenkins, along with Dr. Mark Casanova. And Representative Ramos, if you'd like to take off the introductions, go right ahead and we can just get started.
Thank you so much, Patricia, and thank you everyone for joining us this evening. And thank you especially for Judge Jenkins and Dr. Casanova for sharing your evening with us and this important information to the Dallas County community. So the purpose of this town hall is to discuss the rapid spread of COVID-19 in Dallas County. And correct me if I'm wrong or chime in where you see fit, Judge Jenkins. 1 in 3 new COVID tests are positive in Texas. The state has reported over 300,000 new COVID cases in the last week. That's 1% of the entire population. And we're still, many of the people in the community are still working hard to protect ourselves. We're continuing to mask, test, social distance, vaccination. But with the holidays, a lot of people the virus spread, I think, really quick during the holiday season. We experienced it in our families and in our community. And so there has been a shortage of tests, people trying to find places where to test. We had family from West Dallas come to North Dallas to try to figure out where they can get testing. So testing, of course, remains in high demand. And Judge Jenkins, could you talk a little bit about the testing? I know there was going to be a site open at Fair Park. Did that already happen? And where are people able to access some of these tests and get their results in a timely manner? Because what I have found, and I look at next door and I hear people, their concern is they take the test and then the results don't come back till a week or 5 days later. But by then they've been out touching others.
Right. That problem of the long delay in testing has largely resolved itself at government sites. You can expect 24 to 36 hours at some, and some, rapid. So for instance, at Ellis Davis Fieldhouse, which is in the southern part of Dallas on 20 and Polk, you'll get those results back a lot of times before. They'll call your cell phone before you can make it back to your house. And the others of our sites where we're using a PCR, like the federal site that will be opening in Garland, it'll be 24 to 36 hours. So the sites that we have now that are county sites and or Parkland sites or by appointment only. And let me just kind of tick off some of those. You can also go to dallascounty.org and also the Dallas County Health and Human Services web pages. I'll try to tweet it too, and we'll get you a map of where all these sites are, because they're working on the map of this today. So in South Dallas, we've got Ellis Davis Fieldhouse currently open. And then we opened Fair Park, and Fair Park is open. The Aquatic Center at Samuel Grand Park is open. It's not getting a lot of traffic. That may end up being moved a little bit further away from Fair Park, but it's open for now. North Lake College is open, as is Richland College and Mountain View College. Trinity View Park in Irving is open. We're trying to find a site in Mesquite to get open. And then the federal site, we hope to open very soon, and but there's some delays on it, and that will be in Garland. And I may have left some sites out because I don't have the map right up in front of me. You can also get at-home test kits. So anyone can order free, whether you have insurance or not, from President Biden and what would be the White House and Department of or HHS are providing 4 tests per household. So even if you have 5 people or 10 people in your household, that program only gets you 4 tests per household. And they don't start shipping those until early February, but you need to sign up now. And I think somebody just stuck that link, thank you very much, stuck that link on the screen for you so you can get on there and get those. Now, if you are insured, insurance companies are required to pay for testing. How's that going to work? Well, you pay for the test with at least with most of them. So for instance, the county, we have United Healthcare. You pay for the test, they'll reimburse for up to 8 tests per covered individual. So, you know, if it's you and your kids and you have 3 kids, that's 8 tests for you, 8 tests for each of your kids per month, is at least
Oh, wow.
what United Healthcare is doing. You would buy those, you would submit those on the website. It would be 100% reimbursement. Of course, the challenge right now is in finding those tests, right? It's getting a little better on that. But it is important, I'm going to turn over the rest of this to Mark, but it isn't very important to know your status, right? Because if you've got a scratchy throat, or if you are around someone who they have tested positive for COVID, but you're only around them for a little bit and you're hoping you don't have it, but you go in to the office, this is, I'm told, and Mark can speak more to it, but this is, somebody told me in a meeting, Judge, this is more contagious than the bubonic plague. And I said, okay, help me understand this, because I know I'm a lot older than you are, but I wasn't around for the bubonic plague. So he said, Judge, you know, it's the most contagious thing ever. I was like, oh, okay, I can understand that. So this is, you know, our most contagious virus that we've seen. And so if you go to school, if you go to that meeting, if you go to that family function, you go to watch that ball game with your friends, you can get everybody sick, right? If you, by the way, if you go to that and your friend didn't test and they ended up being asymptomatic or haven't had their symptoms yet, COVID, then, you know, that's going to spread. So really important to get your testing, you know, either at home or after, or from one of our sites. If you get COVID, and Mark can speak more to this, people are like, well, I feel like I should test before I go back to work. If you take a PCR test after 5 days, you're going to be positive. If it take it after 2 weeks, you're going to be positive. You're not actually able to shed COVID, but a PCR test is going to pick up your past infection for 2 months. So the rules right now are, if your symptoms are waning, or they're going down, they're very mild, or they've gone away after 5 days, then you go back to your functions. And of course, if you can work from home, that's great, you know, but you go back to your functions with your mask on, with your KN95 mask on, religiously wearing that, strictly wearing that, not having a meal with your coworkers where you take it off for a little bit or take it off in front of them to have a sip of coffee. But you're either by yourself or you're wearing that for another 5 days from day 6 through day 10. If you're still sick, you're still febrile, or you have a fever, then the 5 days is not the time to go back to work. Let me turn it over to Mark, because he's the doctor and he knows a lot more about all of this than I do. And then we'll be here to answer your questions. And thank you, Representative Ramos, for your great work in Austin, for your great work in Washington, for all of that. That was the toughest year I've ever seen for elected officials. I'm so glad I'm me last year, not y'all. But, you know, great job. And thanks for having us on here and you know, doing what you're always doing to get the word out and keep people safe. And so for those of you who don't know Mark Casanova, when this pandemic began, he was an outspoken voice for saving lives. He's a palliative care doctor, a doctor that takes care of people in the last stages of life. He's got a tremendous heart. He was a president of Dallas County Medical Society when this started, and he's on the public health committee that you hear a lot about. You know, when, you know, Judge Jenkins does something, it's, you know, almost always because the public health committee says we need to do it. So Mark, please take it away.
Yeah, thank you, Judge, and thank you, Representative Ramos, for having us tonight. I sure do appreciate it. Wow, Judge, we've brought you along quite a bit. Your MD is waiting for you right around the corner. So much of what the judge shared is spot on. You know, it's been a heck of a 2 years for all of us. And I think there's so many of us that are ready for this to be behind us. And every time we think we're in a good spot, COVID mutates, transforms, and throws yet another curveball at us. I would just, reiterate so many of the points that the judge made. The CDC, I think, in an effort to thread the proverbial needle, right? Let's find the balance. Made some, what I would contend are reasonable, real life decisions when it came to how do we get people who have been infected back out into the workforce, because we're struggling. We're struggling in our schools. We're struggling in our businesses. We're struggling in healthcare. I could tell you that for sure. And as the judge mentioned, those who are infected, and remember, it's really easy to remember the I in infected, I in isolation, as opposed to being exposed, which is where quarantining comes into place. But the other thing to add to the judge's comments, which is, technically speaking, the period of isolation is still 10 days. It's just that we're giving you potentially 5 days back in the world with a KN95 or other appropriate mask. The other point is, I think, the CDC guidelines, when you read the fine print, you realize, wait a minute, they have a day 0, which actually makes it 6 days that we are asked to isolate with a positive, provided that we are positive. To his point, it's a great point also in terms of testing. And I will personally own part of, as a physician and as part of the voice of public health in this endeavor, the confusion that we have contributed to. And here's what I mean by that. Every step of the way through the last 2-year quagmire we've lived through, there have been different aspects about either the behavior of the virus, our availability of testing, our availability of therapeutics, and or the dynamics of all of those interrelated that have caused us to seemingly change our tune, when in fact, what we're saying is circumstances are different. We said before, don't do X. Now we're saying, go ahead and do X and throw in Y while you're at it. And that comes to the testing that the judge was referencing. We appreciate and look at the PCR test as a gold standard. That's the one that takes a little spell to get back, by the way. Now in our hospitals nowadays, we can get that back in hours. But that was the one that in the early days of this, we were waiting on 7-10 days for results. We, in the beginning, were saying, listen, this rapid antigen test is fair to Midland, as they say in the cotton industry. It's okay, but it's not that great. Let's rely on the PCR. Now, what are we saying? We're saying, hey, the rapid antigen tests have come a long way. And when you're looking to get back into the workforce safely with your mask, then yes, this rapid antigen test is actually the preferable test. Because the PCR is so sensitive, it will pick up even dormant or, in essence, ineffective virus that we will still carry for a spell past the point of contagiousness. So hence this evolution of recommendations from 10 days, you got to keep yourself from the world, to day 0 plus 5, so 6 by my simple Aggie math. Keep yourself from the world, at home, safe, and then get back out there if your employer or if you choose, you want to do that rapid antigen test.
Thank you so much, Doctor, because that was something that we took in my household. Some of those rapid antigen tests, which were the exact same tests that we did when we were in DC, as Judge Jenkins referenced, we as the Democratic caucus. And in my family alone, one evening, my son had spent the weekend with his father. He came and gave me a kiss, as Latino families do. Mom, I'm home. And I said, son, take a test just in case. And he turned out positive. And right away, I got the lights on, started spraying everything, and banned him to his room, and put on masks and started sanitizing everything. And he didn't even know his father got tested. His father was positive as well, and he was vaccinated, both vaccines, and boosted. A young 20-year-old, completely healthy. He has never gotten COVID. We haven't either, knocked on wood. And then the next day he started feeling sick. So it was about 5 days that he, on the 5th day, which is really day 6, because we're not counting the first day, he felt okay. But he didn't go to work, and he mentioned it to his father. So his father didn't go to work. We removed ourselves from him. And I can't imagine how many people he would have exposed had he went to work, had his father went to work, had we not tested. It would have multiplied tremendously. And we're healthy and we're fully vaccinated and we're fully boosted. Could you speak a little bit to that as far as the numbers that you're seeing and the severity of, or the common symptoms that people are feeling, whether they're young and fully vaccinated or those that aren't at all?
No, actually, that's a great question. So, Judge Jenkins was alluding to the extent and the severity of the transmissibility of this Omicron variant. I would put it in the category of crazy contagious. Okay, that's what this thing is. This thing is crazy contagious. Many of us have not seen viral illnesses that match this in its contagiousness. Okay, that's the downside, right? That's the negative. That's where individuals can be around another individual, think to themselves, hey, I've been really good this 2 years. I've been wearing my mask. I haven't seen my cousin in a long time. Certainly 15 minutes is fine, not with something that's crazy contagious. That's the negative. I wouldn't call them positives, but what are the less than negatives? Okay, so first of all, for those individuals who are vaccinated, and especially if they're vaccinated and boosted, okay, another kind of area of confusion, right? I think we're probably inching our way towards defining fully vaccinated as you've had your 2 mRNA vaccines and a booster, right? It's hard for any of us on this call to remember, but once upon a time, a good old-fashioned measles, mumps, rubella vaccine in the beginning was felt and thought to be one vaccine. And now if you have a kiddo like I do, it's just understood. It's the 3-shot series. But it took us about 20 years to appreciate that. With COVID, it takes us months to appreciate that, okay, here's the dynamic of the vaccine, here's what's working. Hands down, individuals who are vaccinated are tolerating the infection if they acquire it much better. I work in a hospital, as Clay mentioned, as Judge Jenkins mentioned, I do regrettably see patients from a different venue and a different perspective. And I am happy to say that I'm seeing fewer patients actively dying from COVID in the last number of weeks. And I think that's 2 reasons. One, the number of individuals who have rolled up their sleeves and gotten vaccinated for themselves and those around them, those they love, their fellow man. Number 2, the activity of Omicron. It is milder, but I want to emphasize one key point. If you take something that is horrible, less than horrible is still bad. Okay, less than horrible doesn't make it good. So where does being vaccinated come into play with this? And we saw this actually in early days with the vaccination. When you are vaccinated, you can still acquire an infection, okay? You generally tolerate it better, you generally do better. There's another thing you do. You have a lower amount of viral reproduction or burden in your body. We call it viral load, as opposed to an unvaccinated individual who will have a higher viral load because there's very little in their body to be the stopgap, right? So that virus lands in them and it's going to replicate like crazy and go wild. Therefore, not only because of that higher viral load, they're going to be sicker, they're going to have more likelihood to spread that virus to others. Now, here's the sad reality is that even those of us who did all we were supposed to do, got vaccinated, boosted, this virus, because of its transmissibility and other aspects that it broke through the vaccine, we too are still able to spread to other individuals, but we are doing it to a lesser degree because we have lower viral load. So that viral load, what we're able to replicate and do in our own body related to the virus has an impact not just for us, but for others. So in our hospitals, we are still seeing a predominance for those who are COVID admissions. we're still seeing a predominance of those individuals being unvaccinated. Those that are vaccinated, as has been the trend since January of last year when vaccines began to roll out, they tend to be individuals who regrettably, by the grace of God and God's challenges, have underlying medical conditions, have high risk situations, suppressed immune system, age. So they're admissions and cases and situations that don't necessarily surprise us. I think to this very day, 2 years in, the thing that many of us lament and it kind of eats at our soul are the ones that are in that many of us may argue don't need to be in, don't belong in, because we have something much easier for them. But we're not going to step away from the fight, and we're going to be in there. So that's in essence what we're seeing related to the transmissibility, how vaccinated individuals are faring. It's also why, you know, you hear us on this sort of ebb and flow of, we think we're okay. No, we got to still protect grandma, right? No, we think we're okay. No, we got to still protect grandma, because now grandma and my dad who lives with me and so many others we love can still be a potential risk despite being vaccinated and boosted, just from the sheer transmissibility.
You referenced a little bit about things have changed, and so therefore some people have become skeptical of, you know, getting the boosted or getting vaccinated. Is it likely that we will need another shot, and should people, another booster maybe in the future, that people should understand this process is evolving, we're learning as we continue? And so if in fact we do, just like children need to get immunizations in school, it may be possible, but that is not speaking to that the science was wrong a long time ago. It's just we're learning as we're going. Could you speak a little bit to that and what we should expect, or we don't know what to expect and we just need to continue to prevent it?
No, it's a great question. And I guess the best way I could answer it is affirming what you just said, which is we really don't know what to expect in terms of more shots, more boosters, more this, more that. What is considered to be a full series? And the reason we honestly and sincerity can't make a proclamation is it's really going to depend on how this thing behaves. Okay. If it goes through a process of degradation, progressive weakening, which is plausible, it just regresses itself back to the good old common cold, and we're not going to vaccinate against that specifically. If it levels off at a level above the common cold, if it levels off at Omicron land, possibly we might be looking at further shots on down the road, but more studies will need to be done with that. But that was only part of the question you posed. I think the other key that you really got at, and it was an important piece, is so much, I think, of how we psychologically, emotionally, and spiritually deal with challenges has to do with being prepared, right? When this thing first hit, we were unprepared because there's something unknown to us. We go through these ups and downs. When we're up, we don't want to hear about a down. When we're down, we're looking for the up. So I think as much as we can be honest and transparent and sort of level set expectations is really key. So this notion and a reminder, another good example of vaccine evolution in terms of recommendations is the pneumonia vaccine, something we give to everybody 65 or older or with suppressed immune systems. Ballparkish, been around for 30-ish years, give or take. Probably took about a good 20 years to hone in and dial in exactly what the sequence of pneumonia vaccines is, what the recommended regimen, boosters, and whatnot are. Another great example, whooping cough, diphtheria. For every grandparent out there, you know now you need to get a diphtheria booster to go see your grandchildren. Why? Because we realized in about the last 10 years, that shot we gave you when you were 18 and you said, good news, you don't need another one of these throughout your entire life, wore off over time. Another example that frankly, we don't tend to blink an eye at because we want to see our grandkids or our kids, whatever the case may be. But those are just examples of the fact that you could take some disease and some viruses that behave slowly over time. 20 years is a reasonable time frame. You take something like COVID, the data analysis and the decisions we need to make are going to be concentrated in months or weeks. So big difference in those two approaches.
Thank you. One of the concerns, and we haven't really spoken much about it, but it's something that articles or certain individuals, the long haul symptoms, right? And it's when you talked about like what our grandparents, an elderly neighbor of ours here, a constituent, was talking to me about polio. And, and he said, when I was in the military, we didn't question whether we needed to be vaccinated or not. We just got vaccinated. And he said, and there were, individuals now who are, as they're older now, well into their 60s, they're now experiencing some, side effects or whatever, not of the vaccine, but not having got taken care of whatever needed to be taken care of at that time. So my question is, are we preparing in the medical world or in the county, right, with these future symptoms once we get out of this pandemic, where maybe a 20-year-old or a 30-year-old who never got vaccinated 20 years from now might have severe respiratory problems, or there's going to be a higher burden on the medical field and honestly on our tax dollars when it comes to now we're having to address long haul symptoms that we didn't know because we're experiencing this just now, 20 years from now. Are there conversations being had and is there something similar that the medical field or the industry is looking at to say this might be something that's similar to another situation that we've experienced in the past?
Yeah, no, and I think actually polio is a really great example, and post-polio syndrome that could manifest itself decades after the initial polio infection as a child or adolescent. And I've had a handful of patients who had post-polio syndrome. So I think you raise a very important piece. And, when you say, what are we at? We've broken 700,000 deaths. That catches your attention, right? And I think for a lot of legitimate reasons, that becomes our focus. Who's dying? How many people have died? I heard a recent statistic that for every death, there are 3 residual chronically ill individuals, whether it be long hauler syndrome, which is sort of this amalgam of an ill-defined, chronic breathing, fatigue, definitely mental fogginess, and I've seen that, and or straight up permanent lung damage. 40-year-old who's on oxygen now. Another huge category of patients who are those that get hit hard with the COVID case, survive. Okay, yay, win. And you see the news story, and we're all happy to see the person go out in the wheelchair. What we don't realize is that person goes home, and then 3 days a week, they're going to a dialysis unit because they're now end-stage renal disease from just the full systemic sequelae and impact that the virus had. So there's an unclear, frankly, an untold number of individuals above and beyond sort of the long COVID, the long haulers, with straight up, just out of the gate, sustained renal failure, lung failure, strokes, and heart-related issues, congestive heart failure. I don't think we have a clear idea of that number. I think it is a safe estimate to say, take 700,000 tragically lost lives, multiply it by 3, and then maybe that's a ballpark number of who we're dealing with now. And you can look at it several different ways, right? Some will say, oh, well, maybe this person was already sick to begin with, right? So aren't they already a chronically ill patient? Okay, but I can think of just immediately 5 patients I've cared for in the last month who were fine and dandy before they got COVID. and now they're a dialysis patient, they're oxygen bound, they're a congestive heart failure patient. This thing manifests itself in such broad ways that it's hard to sort of categorize it. You know, post-polio syndrome is very discrete. It's a musculoskeletal nerve related muscle issue. Post-COVID syndrome is almost darn near anything you can imagine it, and it has that potential. So yes, the point being, as we transition through Omicron, as we see deaths go down, should we rejoice in that? Absolutely. Should we hang our hat on it as, you know, the end all be all? No, because there's still folks who go on to live and survive and may not be able to be that mom or that active dad or that employee or whatever the case may be. And those are untold impacts that we have no idea, in my opinion, where we're at yet.
Well, and that's one of the things that I guess one of the biggest arguments that I make with young folk or family and friends. As an attorney, somebody who needs to think, right? I need to be quick on my feet, and everybody needs to think. But the brain fog is something that's very scary because young people, mid 30s or 40s, they can no longer work in their chosen trained profession because of the brain fog, the neurological problems that come along with it that they can't immediately recover from. And Lord knows what that's going to look like 10 or 20 years from now on that individual. So multiply it by hundreds of thousands of people in America, not to mention the world. We're not ready to address those medical issues of a whole host of individuals. And I imagine that those symptoms or those issues are even more severe with those who have not gotten fully vaccinated. And is it correct? Because I know Judge Jenkins mentioned today that I think you said in Dallas County, 70% of people have had, or people who are eligible to be vaccinated have had at least one shot, but only 15% have been fully vaccinated and boosted. Is that correct? Or those of eligible to be vaccinated. So that is a whole sea of people who still run the risk of some unknown symptoms that potentially could be impactful for the rest of their lives. Is that correct?
That is correct. So not everyone is eligible. Your 4-year-old's not eligible, but of the people who are eligible, over 71% now, just over 71 now, have had at least one shot. Now, some of those that have had one shot, of course, had the Johnson & Johnson, and that's a one-time shot. And most of the ones that had at least one also had a second one because, you know, you Pfizer and Moderna. There's some people that had the first shot, they got sick, they didn't like it, and so they didn't go back. But of the people that most of whom got two out of that 71%, very few of them have been boosted yet. And so it's very important that we get boosted. You know, as I listen to what Mark was saying about diseases, you know, I think about anything that we know is bad for us. We know, guys, there's no question, COVID is bad for you. You don't want to get COVID. And so when we look at, you know, the chicken pox, it used to just be a given. Everyone was going to get the chicken pox. We didn't even try to keep our kid from getting the chicken pox. We just knew that when his sister got it, little Junior was going to get it. He was going to give it to another kid. But now we know that chicken pox is the precursor for the shingles. HPV is the precursor for ovarian cancer and so many other things. You can think about smoking. We find out every few years, like, you know, a few years ago, we found out secondhand smoke was bad. But was there really any question, even before then, in the 60s and 70s, we're not going to be finding out anything good about smoking or anything good about industrial inhalation of chemicals, asbestos and silica. So we want to avoid those things. Getting our booster is one of the ways that we increase the odds of us not getting sick, us not having long haul COVID symptoms, us dealing with it as best as possible, but also of us not giving it to others. And if we really care about our economy, and public health of the people around us, it's the same thing. It's not a dichotomy. It's not a choice between, do I want to have my kids in school? Do I want to have a strong economy? Or do I want to fight COVID? If you don't do the things to fight COVID, then businesses and schools will shut down, not because that mean county judge or someone makes them shut down. They'll shut down because there won't be enough teachers to teach your children. Nobody will be going into the restaurant because the wait staff is too sick to take care of them. So it all works together. Doing these things that are the proven methods of keeping safe work together. And I just remind people, because I know we're going to the political season, and I've got you may as well, but I've got a primary opponent, I've got general election opponents, and they all have different ideas about the virus. I've got an opponent that believes that she's what you call an anti-vaxxer, and she believes vaccines are bad. It's better to get COVID than to get the vaccine, and that if you make children wear masks at school, that's kids in cages, I think is her slogan for that. And that's her belief, right? And, that's just not backed by any science. There's another person that's running, and he believes and the other two believe in vaccines and believe in masking, and they've had that, but they just don't think that it should be mandated. Okay, but the important thing to remember is all of us, including the lady who is an anti-vaxxer and thinks that a mask is akin to some sort of slavery, we should be on Team Human, right? We should be working together to protect our community. This is Team Human versus the virus. It's not Democrats versus Republicans, neighbors versus neighbors. But the way that we really serve Team Human is we do those things that the doctors tell us are the best things. And I know people say, well, but the doctor said don't use an N95 because you need to save that for the medical personnel. Now they're saying only an N95 works. And they told us at first that masks didn't work. And they told us all these things, Judge, and it's all different. Well, it's not that different. And the thing you got to remember is, in a new novel, it's called the novel coronavirus. That means the new virus. They're going to be learning. And just as if, God forbid, any of you ever had a life-threatening illness like cancer, you went in, you found out you have cancer, it's an aggressive form of cancer. God forbid, I hope it never happens. But you've got an oncologist there, and he or she is going to give you your best path. Of course, you can get a second opinion, but everyone working is going to try to give you your best path to your best outcome. And we would listen to the doctors on that. Nobody would say, well, I don't want to listen to an oncologist. I've got a hairdresser who's read some things on the internet. Now, don't get me wrong, I don't want an oncologist cutting my hair, and I'm not against hairdressers, but I'm not going to have a hairdresser, cover my cancer. I'm not going to have an oncologist cut my hair. Okay. So we would listen to our oncologist. We would do what the oncologist says, because that would give us the best chance, if it were you or your loved one that had the cancer, of surviving. Same thing here. We got to listen to doctors like Mark Casanova, who prepared their entire adult lives for this moment. I'm just a dumb old lawyer and county judge. Okay. And if you remember the old commercial, I did not stay in a Holiday Inn Express last night. So Mark jokes that I'm going to get my MD because I understand this stuff, because I spend my waking hours trying to understand it so I can keep you safe. But what I need to do is listen to what people like him say, and people like the head of infectious disease at UT Southwestern, Tony Fauci, and others tell me. And then I need to act decisively to try to keep you safe. What you need to do is listen to what they say too, and do those things for your family that'll keep you safe. So right now you got high spread. It's not the best time to go pick up your groceries in the store. Use the curbside. It's not the best time to get together with your friends. What Dr. Wong is telling me is that by March, we'll probably be way down in our numbers. That'd be a great time to get together with your friends, but not right now.
Thank you, Judge. Dr. Casanova, the judge, and I want to thank you for being so a pioneer, really, in protecting our community here in Dallas County. I mean, I remember when you made that decision, and my neighbors were like, thank God, the decision is being made. And they felt a little we all felt protected, like, okay, somebody actually cares and is following the science, because it was so contradictory. And unfortunately, we really haven't gotten away from that, even though we have a new president, but at the state level, with the conflicting messages from the governor and almost 80,000 deaths in the state of Texas. But I guess one of the things that step back, I have a neighbor in the community, and the child was starting public school. And we were, I just remember that I felt like we as elected officials robbed these families of their children's first day of school, right? And the excitement and the, picture taking and sending their baby off to school. Like those of us who have children, when my baby was in first kindergarten, we took pictures. It was a wonderful thing. My neighbor was scared, and what do we do with the schools, and are they going to require masks and not, and the parents were getting conflicting information, and children are getting sick. Dr. Casanova, are you see, and I'm hearing more and more little babies, like young ones under 2, 4-year-olds, 5-year-olds. Is it just me? It seems to me that it's more now, more of the little ones are getting becoming infected with the virus than even 6 months or a year ago.
Yes, on a raw numbers perspective. From a statistical perspective of who's being impacted, it's pretty even throughout, right? But we recognized early on in the pandemic that younger individuals young-ish, tend to do better-ish. Okay. One of the challenges, and I think the judge alluded to this, is how we message and how we relay information, right? There's a Catholic theologian, Anthony DeMello, who said, we see not the world or people or things as they are, we see them as we are, right? So if my wife tells me something, I'm going to interpret it from the way I want to hear what she said, and then suddenly I'm not in trouble, but then she'll remind me I am. So there's a little bit of that in this, right? So when we said early on, younger individuals tend to do better, the takeaway was kids are fine, right? And we had to kind of go back and say, no, kids do better. But remember, less than horrible can still be bad. So yes, we are seeing more pediatric cases, but we're seeing more adolescent cases. We're seeing more adult cases because the sheer numbers are just so damn high. But in terms of the kiddo perspective, yes, it's there. It's undeniable. Our pediatric hospitalizations are the highest numbers they've been. And I think it's a challenge. You bring the notion of schools. My daughter is 12, so went through that loss of the first day of school. No pictures this year. And I think sometimes we need to kind of take a step back and remind ourselves of a couple of things, right? So in 1918, 1919, everybody lost that first day of school. There's been certain times throughout our recent history, 1918, 1919 predated all of us, but things that just impacted the way that we worked and did normal or operated in a normal life. And then I think we have to remind ourselves that 700,000 people don't get to see that first day of school anymore for their kid, their grandkid, whatever the case may be, right? I'm not trying to belittle it or blow it off, but sometimes there is a component of perspective and saying, okay, where are we here in this common experience, this common reality, and how do we come out the other end of it with a common good? So I think from the whole child perspective, the educational perspective as a whole component that has been a hot topic. And actually, the judge nailed it. And oftentimes we try to drive home the point too, that masking doesn't mean close down a business, right? Masking doesn't mean shutter the economy. No more than mask or getting kids back in school with a mask means that we're somehow robbing them of that childhood experience. You can't have it both ways, right? That's just a reality. It's pick and choose. You can't say no vaccines, no masks, full on normal life. Hey, listen, guess what? We've run that experiment and it hasn't gone well at all. So, I tip the hat and provide an immense amount of gratitude and graciousness and grace to these school leaders, our superintendents who have to make some really tough decisions. How do we catch kids up? How do we get them in the environment that we do all agree they need to be? How do we help out working parents, right? Who don't have the bandwidth or the finances to say, well, great, we'll get so-and-so to watch Johnny at home. That can't happen. And how do we keep them safe? So, leaders and examples, I can think of, Superintendent Hinojosa, who says, hey, listen, we're going to get back, but you're going to be in masks. And those were very brave decisions that our school leaders needed to make. And I think so many right now are in the position as we came through the winter break of saying, listen, we went into the winter break thinking we were done with masks. They read the situation on the ground and said, masks need to be back on for kiddos. And so I think it's just so much of life is give and take. And I think if we all kind of take a step back and say, hey, how do you do your marriage? How do you do your home life? Why doesn't this apply? Why don't those same principles apply? I think we'd probably be in a better spot.
Absolutely. And it seems to me we wouldn't be in this spot had we all done what we needed to do in the beginning. I read an article somewhere that said before the vaccines were available for children, that the best way to protect the children in your home is for every adult around that child to be fully vaccinated and boosted, and it would help stop the spread. But the fact that we have literally gaping holes where the vaccine is running through, it is getting into our children because so many of us as the adults are dropping the ball. One of the examples my neighbor put is, if my house is on fire, do I say, does the government allow me to say my house, I can let it burn because it's my house? The government doesn't let you do that because you can get the other houses can catch fire. And we have a responsibility not only to ourselves, but to our community. And not being vaccinated means you're letting the fire spread. But with parents sending their children to school, many parents, I would say probably most parents want their children to be protected and to be masked. Is there anything, Judge, that parents can do to ensure school districts follow the science, or that we continue to wear masks so that the children are protected? Is there anything parents can do to protect their children and ensure that the schools follow the county orders, or at the very least science, and ensuring that teachers and students continue to wear masks?
Absolutely. So for instance, in Richardson, I'm just, going to be honest, Richardson had a great superintendent in Jeannie Stone. About 20% of the parents were opposed to masks. About 80% on a Survey Monkey sent out to the parents were for masks. By the way, that's about how it works at DISD and every other district. 80%, the silent majority, is for protecting the kids, doing their part. 20%, the loud, angry, put upon folks are against it. And, in that situation, unfortunately, there was a lot of blinking that happened above Jeannie with her board, and they didn't, have a mask order for about 3 days there. They brought the kids back on Tuesday. They saw a 2,500% increase in COVID over 3 days. And I had to shut some schools and do some things, and then they put the mask back in place. That may help with Richardson. I think if you're in that 80% that want to protect your kids, that don't want to see your kids maybe get long haul COVID. People say, well, COVID's not that big of a deal. This Omicron's not that big of a deal. Former chairman of the Democratic Party, I know you're a Democrat, there's probably a lot of Democrats on there. Former chairman of the Democratic Party, Boyd Ritchie, his mother got it on Friday, she died on Monday. And she was an older person. But last week I've looking through the list, I got 19 dead today. One day I had 11 dead. One of them was a 22-year-old woman with no underlying symptoms. So, as we talked about earlier, it's a bad thing. Be that active pain in the butt parent. Only be that, there's pain in the butt parents out there, kids in cages, my body, my choice, I can't breathe, constantly appropriating or misappropriating, phrases from a real civil rights struggle to use because they're, let's just be honest, they're a bunch of privileged Karens who don't want their kids to have to wear a mask, right? And it's almost like they're involved in abusing their own child, making their child into some form of a freak with their fellow students. But they're very persistent, they're very loud, and they're very effective. They're also almost terrorism almost to a certain extent of superintendents. I talk to superintendents, have these calls with them on Zoom with 50 or 60 superintendents. And it feels a lot like my first responder calls. I'm asking people, are you sleeping? Are you eating? Are you spending time with people you love? Trying to just keep their spirits up because they're getting their butts kicked by these nuts. So get out there and be loud and protect your kids and be that voice. When you go to a school board meeting, you're probably not there. And I'm talking about Representative Ramos. I'm talking to moms and dads out there. But there are some loud people that are there, and they want the opposite of what the CDC and the local doctors say would protect your kids. And by the way, there is still an order in Dallas for the schools to mask the kids if you're in public school. I don't have orders on private schools because of some legal issues, but it's still that order on public schools. And we expect people and hope people will follow it and help us save kids.
Thank you so much. And thank you both so much for burning the candle at both ends and protecting our children and protecting our Dallas families. Any closing remarks, Dr. Casanova?
No, outside of thank you. Thank you for your efforts. Thank you to our judge. And thank you for the participants. We're going to get through this. And I guess there's a part of me that's hardwired to be an eternal optimist, to hope that we can take some hard lessons that we've learned from this and come out as a better community. But just on behalf of the healthcare community, it lifts our spirits when we know that there are folks out there who still care. And Judge is right. Actually, the truth of the matter is, and the reality is, the loudest voice is the one who gets attention, right? So sometimes I think if you watch the evening news, you would think, well, hell's bells, everybody in the world is against this effort to love one another. And that's not the case. That's not the case. So just thank you and stay safe and wear your gosh darn mask.
I think as soon as everybody masks up, vaccinates, and gets boosted, we'll get over this. But we need 100% participation, all hands on deck. So thank you so much. Thank you for taking care of our families. And I hope everyone enjoyed this. I learned so much tonight, and thank you for all your good work. Have a good evening.
Thank you. God bless you.
Bye-bye.
God bless you. Bye.